Good afternoon. I'm Gregg. I'm the Chief Clinical Officer at Partners Healthcare. I am also a general internist practicing at both the Brigham and the MGH in the spirit of Partners Healthcare. And I am pleased that you are spending this time with us here and participating in the forum. It's truly an amazing event, and part of it is just having all of you in the room with us. One of the other special treats that are part of this is the opportunity to talk to real leaders in healthcare from across the globe, and we have that privilege again this afternoon, and we're joined by Frans Van Houten, who is the CEO of Philips. Frans actually joined Philips in 1986 after he got his degree in business and economics from Erasmus University in Rotterdam. And then he spent many years working there, CEO of one of their divisions, and then actually left for a couple of years, 2009, 2010 as a consultant, but came back in 2011 as the CEO of what is a $18 billion company with global reach and profound impact on many of us. I think many of us have spent much of our lives staring at monitors and seeing the data scroll across and recognizing that Philips is actually helping us take better care of the patients that are in our trust. With that, I'm going to jump right into the conversation. And one of the things I think that's fascinating about Philips was the notion that when I think about Philips, I think about many different things, everything from light bulbs to TVs to cardiac monitors. But Philips made a big change under your leadership. It went from being a very diverse conglomerate, in many areas, in many sectors of the economy, to focusing in on healthcare. And tell us a little bit about why you did that, how you did that, what was behind it.
Yeah, Philips has been for 125 years a diversified holding company doing a lot of things. And I felt that as an innovation company, we needed to go really deep rather than wide and shallow. And so we shed consumer electronics and lighting, actually more than 10 billion of revenue. We became a third smaller, and we have been reinvesting the proceeds to deepen our, activities in healthcare. Why did we choose healthcare and not something else? Because that we could have, right? So we said an innovation company needs to focus on challenges in the world, right? And we said in this century, healthcare is hugely exciting. Technology can really create breakthroughs. We have a very decent starting position, so let's put all our eggs in one basket and double up on healthcare, and that's what we're doing. In the last few years, we have increased R&D. We have made a massive foray in healthcare informatics. We still continue, of course, with diagnostics and patient care and home care, but we believe that by stepping up on the informatics side, it's like the glue along the health continuum, taking down silos, helping care providers, practitioners to do a better job on the basis of integrated data around a patient's journey and truly being able to drive outcomes and productivity. And it's our mission to basically enable that.
Terrific. Well, I love the glue analogy because I often, when I try to tell my colleagues about what it is that I do for a living, I say, the glue that's trying to hold that together. But one of the challenges with being that glue is you have this very big kind of role in saying we're trying to improve health and healthcare, but you got to measure it. Yeah. And one of the things that I was fascinated by was just the whole notion that you set this, this big, hairy, audacious goal saying that Philips is going to improve the lives of 3 billion people on planet Earth by 2025.
That's right.
Pretty amazing. Tell us about how you did it, how you set the goal, how you're measuring it. Where are you now?
So I like big goals, but they need to be achievable, of course. And we wanted something that is more motivational than just saying that, we want to double our market cap and we want to get back to 25 billion euros. So we said, yes, we will do all of that, but that is maybe not what drives people to really innovate and contribute their lives to companies. So we said, let's take a goal in humanity, inspired by the SDGs, Sustainable Development Goal number 3, United Nations, and improve people's health and well-being. And so we started measuring how many people do we touch through our products, solutions, services, And today, we are a little over 1.9 billion annually, on an annual basis, taking out double counts for people that, let's say, get scanned twice or whatever. And we think it's achievable to reach that goal. Now, we have to crack the code on Africa, India, Indonesia. In other words, we have to get to primary care solutions in emerging markets, which, as we all know, is deeply needed. Infant mortality in Africa is still 6%. And then you can say, well, let's do ultrasound scans in Africa, but it didn't go, right? And so we've been struggling to get to breakthroughs for the next billion. And in the meantime, together with a lot of NGOs, we have developed kind of a clinic as a franchise. And that we are going now to roll out at scale in Africa. And I think that will get us there.
That's terrific.
It's terrific. It's very exciting. And it gives you a different view on innovating for every price point, right? Because we are a high-end company, and thank you, many people use our advanced technology. But that advanced technology may not solve the problem of accessible care, right? Affordable care. And so we have learned that in order to reach our goal, we need to develop affordable technology.
So talk to me a little bit about how you as a company, when you set this amazing goal of trying to touch 3 billion people, how is it that you say, how do you get the company moving forward quickly? And how do you accelerate things? What's your approach to innovation, and how is that working for you?
Well, there are multiple transformations going on in Philips at the same time. You could say shedding divisions is a life-threatening event for a 125-year-old company. And we could counter that by saying, well, we have this North Star and it's exciting, so people get motivated by it. But that for me was not enough, because we also need to do the glue thing that we talked about, and therefore shift from products that are used in silos. And I think everybody here in the room will recognize what I say. I mean, if you do a scan, you have a picture. But for truly outcome-oriented healthcare, we need to interpret what is in the data rather than providing the data. So we need to unlock the power of technology. And that meant that every business unit in Philips, and we have 40, needed to become cloud connected, right? Now that's another big transformation, right? Where we say interoperability, open standards, don't duplicate, but work together and start working towards what we call solutions, right? And then we said, okay, a solution for what, right? Because we shouldn't boil the ocean. And so we selected what we call health spaces, or the care continuum for cardiovascular, for neuro, for oncology. And we said, now we want to understand what is the patient's journey along these care pathways, and what do we then encounter. And then we started co-creating with leading academic institutions, like, for example, Karolinska in Stockholm for stroke, and say, let's map out the stroke care pathway and see how technology can get you from calling 911 to needle time to less than 90 minutes. Now, then you have to innovate for different things than just a better CT scanner, right? We still do the better CT scanner, but finding ways to get the data and bypassing the ER, actually getting the patient straight into the hybrid operating room, was necessary to meet the goal of Karolinska. And it's fantastic if you can sit down with clinical partners and work on a problem statement like that. Right? And I'm also, and that's maybe the third transformation, where we want to move away from being a vendor, because there's only so much you can do as an innovator to tackle real world problems if you are being treated as, well, sell me a box. No, I don't want to do that. I want to be partnering on innovating the procedure, right? I want to be partnering in taking the waste out and helping to industrialize what can be industrialized, because repeatability, less variance, better outcomes, less cost, and advance insights into patient care for either prevention, first time right diagnosis, first time right treatment, and helping to move patients out of expensive settings into, let's say, community centers, SNFs, and eventually home care. Right? But then you are, let's say, not piecemealing innovation within narrow boundaries. You take a wide perspective at the problem statement, and then you work together with your partners on saying, well, what do we need to do?
You know, it's interesting to hear you talk about this notion of part of your work, leading a huge organization, is to focus in on getting it more affordable. That's not something we would necessarily hear all the time from healthcare companies around the world. So tell us a little bit about how you are actually doing it. You talked about getting the waste out, but what is Philips actually doing to make that happen, to make sure that we actually not only have these amazing technologies that we can bring to patients around the world, we actually can do it in an affordable way?
Yeah, so partly affordability is in the sticker price, but partly affordability is making sure that you get the maximum out of the technology that you have, right? And to improve the efficacy of technology, in many of your professions, you're actually used to work with industry consultants, but it doesn't happen everywhere, right? So we decided that we will set up our in-house consultancy within Philips in order to help providers do transformation, and to lean out processes, to improve, let's say, data accessibility, to improve the purpose of data, where we unlock databases and we apply machine learning and artificial intelligence in order to develop algorithms that can actually support the doctor in their, for example, diagnosis. So you're moving from, let's say, the device or the system to making information intelligent, let's say, useful. And if you do that in an appropriate way, and at the same time you make sure that all the participants in the care pathway work together in a seamless way, that is how you take waste out. It doesn't necessarily have to all the time result in a lower cost per unit, as long as you drive the productivity forward. Now, for emerging markets, that's a different discussion, right? Where we also need to make sure that the overall sticker price is lower.
It's lower as well. You know, one of the things that you talked about was this notion of trying to use data and to try to give us insights, convert to information. One of the areas that's been a long struggle in cardiovascular care and in intensive care in general has been just recognizing when patients are deteriorating and,
yes,
and developing early warning. And we've all had this notion that, you know, that we have all this data here. If only we knew. It always makes sense when you look back 24 hours later or 48 hours later, say we should have recognized it then. What's Philips doing to try to solve that, to make that available to me in real time?
Yeah, so we have in the area of patient monitoring, patient care, several solutions. If we start with the intensive care unit, many hospitals struggle to staff an intensive care unit 24/7, and you have then seen the emergence of the hub and spoke model, where an intensivist intervention center will overlook beds elsewhere. This is then what is behind the so-called EICU. Now, once you do that across multiple hospital locations, ICU locations, you start measuring data. And for two purposes. One, measuring how a patient is evolving, and early warning signs. Maybe we can already see that a heart attack could happen 6 hours from now. But the second purpose of data is variance across your enterprise, where one, let's say, institution isn't doing as well as the other. And by comparing the data across multiple patients and multiple sites, you can actually all improve to a higher performance level. And we have seen a reduction of significant adverse incidents by 40%, a reduction of deaths by 25%. Wow. So it's a pretty phenomenal insight. Now we have brought this technology forward to the general ward where maybe you keep patients in the ICU too long because the supervision in the general ward is not high enough and everybody is working so hard already. If you have surveillance in the general ward, you can rest assured that you get an early warning signal there. Now, the same then you can apply to specialized nursing facilities. And then in the context of let's say, outcome and value-based care, wouldn't it be good to move patients faster into their community, where maybe their family and friends are, yet with a remote supervision from the hub, where, let's say, the intensivist expertise is available. So this, of course, is all driven from big data, but then made actionable in a very practical way, one patient at a time.
Yeah. So my colleagues in radiology and in intensive care in the audience, some of them will have to be getting a little bit nervous, right? They're hearing like, wow, we're actually be able to automate all these things and start to read the films and glean information from it. Why is it that they shouldn't be threatened by this? Why? How is this going to lead to a brighter future for them?
I think we all need to reinvent ourselves all the time, right? I mean, this is the world, and the Industrial Revolution did that some years ago. It will happen in the 21st century. So a few examples, and then why people don't need to be worried in the end. In the Middle East, we have an application for TB screening. To get a work permit in several countries in the Middle East, you need actually a chest X-ray to screen for TB. There are not enough radiologists. And on the basis of 800,000 chest X-rays, we have developed with the University of, I think, Qatar, an algorithm to actually detect this automatically 99% accurate. So just to the point that this is possible. And so I think we should not deny that the state of technology is moving very fast. At the same time, complex diseases create an overwhelming amount of data. And why would you spend time on routine tasks if actually you could spend more time on the interpretation of multiple sources of data and then making that insightful and actionable, right? And before this, we were chatting about measuring the progression of Alzheimer, the brain scans. This is very time consuming, and with AI applications, you can get to a assisted application where some of that is done automatically. And so there are many applications where informatics can play a big role in taking and supporting radiologists, or for that matter, a pathologist, because we can talk about digital pathology as well, where this can play a big role. Now, where is the unmet need? And I give you an example around data integration. Right? We did a clinical study with a university in Europe around oncology patients. And we found that in the space of oncology informatics, where it's really important to integrate the data from genomics, pathology, radiology, and even longitudinal data in a good way, that historically that particular academic hospital had 25% of the cases where the decision was not the right one. Right? Where even there was over-processing or under-processing, patients got chemo, but maybe they didn't need it. And this was, in their study, they went back through their files and applied the integrated approach, you could say, the oncology informatics approach with the integrated data, and they came to that insight. Right? And they're going to write it up and publish it. But so it creates the need for what we can call a clinical data scientist, right? Which I think is very, very exciting to do, and where there is a big need for that. And I think especially it can unlock quality of care in, let's say, also regional hospitals in a fantastic way.
So some of those insights, though, I'd have to say, are pretty sobering. The notion that 25% of the time, even at a respected organization, you're not getting it right. Philips is at the leading edge of innovation. Do you find sometimes, well, what do you do to ensure that the organizations that you work with, the provider organizations out there, that they're ready for the innovations that you have? How do you get them to accept
first of
where
all,
you're
we
going?
need to develop it. And I want to underline that we do not develop this on our own. We develop this together with you. Right? And it is essential that technology companies have a close collaboration for clinical research and clinical validation. And so I see a future where R&D is co-creation. And it has a huge advantage for us as well, because that means that you get to scientific publications, clinical validation, and that in the end is what is needed also for market adoption. Also the FDA struggles with, let's say, some of these AI applications and more the systems approach, because if you have a single isolated product, it's maybe more familiar to check it versus a holistic approach where systems, software, services all interact. Now, what is exactly the boundary, and if it is then also self-learning, that is a scary world. So we have a lot to discover together, and I cannot underline enough the importance to work together on it. The adoption in the marketplace goes at different speeds, and it is quite a fascinating insight that hospital systems that choose to run their network, their IDN, as a operation actually move faster in the adoption of technology than the ones that don't. Now, why is that? Because as they want to run it as an operation, they take industrial insights and concepts and start measuring the variance across their network and are starting to look for technology to make insightful. If you are the head of radiology across a whole, across 20 hospitals, and you don't have the insight how everyone is doing, then how can you drive that responsibility to drive better care in maybe with budgets that don't expand, and yet you want better outcome for patients, you want the best professional achievement, and so creating insights is essential. And so I see that those hospital systems that have an operations approach to improvement, they advance faster, and they are keenly interested in these kind of technologies.
That makes me incredibly happy to hear that. One of the things I think it's interesting to think about as a global company is where is it that you have, in your experience, the greatest challenges in getting some of what Philips has to offer, getting it into practice. I'm thinking again about that last $1 billion you're trying to achieve, and thinking about Africa and Southeast Asia and the rest. What's the most challenging place you're working in? How are you trying to tackle that problem?
Well, I don't know. I don't even know where to start. There's plenty of challenges. We spoke in the beginning of this conversation about the transformation of the company. That is never finished, right? Because if I want, let's say, the people in the field to have this kind of a dialogue with hospital systems, it's a completely different and much more consultative approach. Rather than, let's say, being the expert in one single product. Right? We are hiring more doctors because the understanding of the whole clinical practice is so important. Developing markets is a challenge in its own right, which we actually had to bring to those markets. What many of you may not know is that Philips employs 17,000 people here in the United States, actually more than in Western Europe. But to develop for Africa, we set up a lab in Nairobi, right? Because you have to be local to understand the impracticalities of what we sometimes innovate in the Netherlands or here. Right? And I think that's fine. There's horses for courses. and we needed to go back to the basics for, let's say, the McDonald's chain of primary care clinics in Africa, which was a kind of a different technology challenge. And while, by the way, keeping an open mind to leapfrog, because in the rural Africa market, if you imagine that a clinic in the rural areas then gets connected wirelessly to a nearby city, and all interpretation of data is done in the city.
Remotely.
Right? So the hub and spoke model will get implemented right away from the get-go. And as we do that, creating a medical record on a nationwide basis rather than on an enterprise basis will also be done.
Wow. So, you know, on the other end of the spectrum, in the work that I had a chance to read about that Philips is doing, I read about Dubai Heart Safe City. Can you tell us a little bit about what that is? It was a pretty interesting notion.
That's a pretty cool application. So the United Arab Emirates want to be the safest place. And they will, I think, host the world exhibition and soccer and so on. So they basically said, under our leadership, nobody should die in the street, right? So if anybody has a cardiovascular incident, falls down in the street, something has to happen. And then they said, well, and they work with us. So if we could actually crowdsource where is the nearest AED, and if we could then also crowdsource who is it trained in resuscitation, right? And if we bring all that data to the point of the incident, wouldn't that be fabulous, right? And if everybody has that on an app on their phone, then, you know, I have an incident, maybe somebody calls 911, we immediately see here's, it can pop up on your phone if you are in the network. So they will ask everybody to self-declare whether they're prepared if they walk the streets to do the resuscitation. And so it's like Uber, but now for cardiovascular care. And so this is actually being rolled out right now, and it's fascinating. And yeah, it's a cloud application, and it connects patients, people, and AEDs.
So one of the unique privileges that we're going to have here is the ability to host next year's forum. We're going to talk about artificial intelligence. I'd like to invite you to participate in that based on what you said today. And one of the things that you touched a little bit on was this notion of trying to weave together that whole promise of precision medicine, that we're going to be doing the right thing for the right patient the first time always, and all the data that we could potentially bring to bear on that. How are you, kind of from your vantage point of the CEO of this global company, how are you trying to drive towards that? What are the steps that you're taking to try to make that a reality? Where to start? So we spoke about AI in patient care, right? And in the care coordination, in the support of the patient's journey. With the ICU and the early warning systems and so on. We spoke about AI in the area of radiology, and I alluded to pathology and, as ways to make all those professions, support all those professions. And then we started to talk a little bit on how does it all come together. Because I think this is where it is truly exciting, and I alluded to I gave you the example of having all the information together leads to better decision making. But I think eventually where it will go is that you can then take even a step further with predictive treatment pathways. Based on the phenotype, on all this information, what is the treatment that has the best likely outcome? This is work that we are doing here in Cambridge in our lab, and I think it's still very early days because you have to do this for every individual disease, and this is where big data can be truly leveraged. I think it's very exciting. It's an exciting world, and what I would say is is, on behalf of all of us, thank you so much for spending your time with us this afternoon, and also good luck on achieving the next billion. We all need you to be successful.
Well, thank you very much.
Thank you very much.
Thank you for having me.